In this video, you'll learn the side effects of oxytocin and oxytocin's mechanism of action. Pharmacology can be challenging to learn in nursing school, so we're going to break it down super simple for you, step by step, so that you can finally understand it. So don't worry, friend, you don't need to figure everything out alone anymore for nursing school. We're here to help you every step of the way. And if you need more help with learning pharmacology in nursing school, be sure to download this free pharmacology cheat sheet that walks you through how to study pharmacology in nursing school step by step. The link is down below for you to get that. Now hit that subscribe button and click the notification bell, and let's dive in.
Okay, let's talk about oxytocin. The generic name is oxytocin and the trade name is Pitocin. The pharmacologic class is an oxytocic and the therapeutic class is a hormone. The indications of oxytocin, or what it's used for, is to help stimulate uterine contractions to initiate labor or to control bleeding immediately after the placenta is delivered. The mechanism of action of oxytocin is to stimulate the smooth muscle of the uterus to contract by increasing the concentration of calcium within the muscle cells, controlling the contraction of the uterus. The therapeutic effect of oxytocin is induction of labor, contraction of the uterus, and to control postpartum bleeding. Some side effects of oxytocin are that it can cause increased painful contraction, but it can also decrease uterine blood flow, which can increase the risk of asphyxia or hypoxia to the fetus. Coma or seizures, as well as hyponatremia or hypocholeremia, can happen in the mothers because the Pitocin hormone is very similar to an antidiuretic hormone, and it has some of the same effects. For your nursing assessment on a patient taking oxytocin, you're going to want to monitor the fetus for tolerance before and throughout the administration if it's used during labor. Fetal lie and presentation should be assessed too, to make sure the fetus is in the optimal position for birth, because we obviously don't want to induce labor unless a vaginal birth is likely. Monitor contractions for frequency, duration, strength, and fetal tolerance throughout administration. Monitor the mother's electrolyte levels, especially sodium and chloride, because it can cause hyponatremia or hypocholeremia. Monitor uterine bleeding after the expulsion of the placenta. Major contraindications for oxytocin is that it should be used only if a vaginal delivery is possible and expected. For patient education, when your patient is taking oxytocin, make sure they know that the contractions should start out with cramping similar to menstrual cramping and increase as the administration progresses. Nursing considerations for oxytocin is that the contractions may be more severe and painful with oxytocin, so both the mother and the fetus should be monitored closely.
Now, if you want to deep dive into all the other medications you need to learn about in nursing school, do not miss the medication database that we have for you inside the NursingSOS membership community. If you're frustrated because you have to figure everything out yourself in nursing school, don't worry, friend. We will teach you everything you need to know step by step so that you can learn it faster and easier. The link is down below for you to check out all of the details. Now be sure to like, comment, subscribe, and share this video with a friend, and click on one of these videos right over here so you can keep rocking nursing school. And as always, my friend, go become the nurse that God created only you to be. And I'll catch you next time on the Nursing School Show. Take care. Bye-bye.